Good afternoon, Mr. Chair, members. I'm presenting for your hopefully favorable consideration today Senate Bill 993, which basically does three things. In short, number one, it updates provisions of law governing registered dietitians, RDs, working in licensed institutional settings. Secondly, it aligns the registered dietitian technician, also known as DTR, qualifications with national standards. And thirdly, it permits registered dietitians to make modifications to patients' dietary treatments or diet orders as long as the changes are within the parameters of the physician-prescribed diet order. Amendments in print just this morning attempt to resolve concerns raised by a couple of organizations that had an opposed unless amended position to the bill. I think that we'll probably hear from the California Nurses Association because I don't believe the amendments in print address their primary concern, but we can hear from them specifically. As the committee analysis points out, the concerns raised by the Center for Nutrition Advocacy stem from their opposition to the state's recognition of dietitians in existing law. Their concerns, we believe, are outside of the scope of what this bill is attempting to accomplish. Contrary to concerns about patient safety, the amendments make it clear that SB 993 only allows the registered dietitians to make changes to dietary treatments to the extent that the modifications fall within the scope of the diet order and the physician's diet order does not prohibit modification. This language was taken to ensure that physicians have the final say in whether patients' dietary treatments can in fact be changed. The purpose of this bill is to increase efficiency in patient care delivery and patient outcomes in institutional settings by allowing registered dietitians to work collaboratively with patients' physicians and multidisciplinary teams to identify and implement proper diet and nutrition interventions within the scope of the physician diet order. I have with me here today Jim Gross and other representatives from the California Dietetic Association who are the sponsors of the bill to answer any technical questions committee members may have.
Thank you, Mr. Chair. Members, Jim Gross on behalf of the California Dietetic Association. I have members of the board of the association here with me who are practicing dietitians, and they can address some of the issues that you might have. Let me just say quickly, California does not license dietitians. It simply has a statute that recognizes them based upon their national registration through an accredited body. This law is nearly 30 years old. It has not been updated. The purpose of this bill is to update both the education requirements and, as Senator Mitchell said, make some changes so that, in fact, the dietary order that is written by a physician can be adequately carried out. We can have a couple of comments from our folks here who can explain very simple examples of why that is necessary. We have worked with both the organizations that represent nutritionists throughout the country and with the California Nurses Association. I think the nutritionists understand that the goal of this bill does not address their specific concerns, but we have pledged to continue working with them because they are a legitimate profession and should be included in the dialogue as we go forward. With respect to the Nurses Association, we took a number of their amendments. The crux of the difference is that they wanted an amendment that required the physician who wrote the diet order to write on it that they would allow for a change in the diet order consistent with the order. What we offered them and did put in the bill is that if the physician did not want any change, the physician could write that on the diet order. That is consistent with how generic drugs are dealt with. If you don't want any substitution, you say no substitution. The physician is not put in a place of having to anticipate all of those things. So we think that change does provide some greater protection. We actually thank the Nurses Association. Some of their proposed language was very helpful. I don't know if we can get there, but we will continue to talk with them. If you have any questions, again, we have two dietitians, practicing dietitians here to respond to them.
Thank you. Other witnesses in support?
Good afternoon. Connie Delgado with the California Hospital Association, pleased to be in support of this bill. Aims to improve patient safety and meet the goals of the Affordable Care Act, so we're in support.
Good afternoon. Angelica Gonzalez on behalf of Kaiser Permanente in support.
My name is Ashley Clay. I'm a registered dietitian working for Kaiser Permanente in Vallejo, representing SEIU-UHW, which represents 150,000 healthcare workers in California, and representing the SEIU State Council, all who support the passage of SB 993. In 2011, my mother was hospitalized with malnutrition. The oral protein supplement recommended by the dietitian to the physician did not arrive with her meals until 3 days after it was recommended. SB 993 would prevent the delays in providing patient care as opposed to my mother's example. Malnutrition is a very significant concern in hospitals, with 1 in 3 admitted patients having malnutrition upon admission. Malnutrition results in more frequent readmissions and longer hospital stays. This means that providing the right nutrition is as important as prescribing the appropriate medication. As a dietitian, I thoroughly screen and interview patients at risk of malnutrition and collaborate with the team to work toward reversing that malnutrition. Passing of SB 993 would allow me to help the physicians I work with provide efficient and timely patient care. Daily, I receive calls from patients, their families, nurses, and other staff requesting simple clarifications for patient diets, such as snacks, soft foods for those who can't chew very well, and protein supplements. Under existing law, if I made these clarifications myself, my institution is at risk of citation. However, such in my mother's example, the delay to make these simple modifications can be quite significant. I ask for your support in passing SB 993 to provide efficient patient care. Thank you.
Thank you. Other witnesses?
My name is Kelly Scanlon. I'm also a registered dietitian at Kaiser and Vallejo in support of SB 993. Just in the past week, I've had doctors call our ordering system Hell Connect, saying he often doesn't get to our dietitian messages and requests till the end of the day, as he's dealing with more urgent issues in the ICU. Even the next day, I made a request in rounds for a protein supplement, and the doctor agreed and started to order it, but then realizing he didn't want to take the time of the other occupations, he asked me to email him so that way he could get to the request as later in the day, and he sarcastically put it as he would spend the rest of his life trying to get to my request. A good portion of our day as dietitian is spent calling, paging, and tracking down the doctors, and it's painful having to wait hours or sometimes even days for our patients to get approval for adequate nutrition, whether it be an oral supplement for a patient with poor appetite or increasing the grams of protein for a patient newly on dialysis who now needs twice as much. So passing this bill, I think, would allow to help us improve patients' nutrition status immediately with the click of a button rather than having to wait. Thank you.
Thank you. Other witnesses in support? Witnesses in opposition?
Mr. Chair, members, Stephanie Roberson on behalf of the California Nurses Association. Here in a opposed unless amended position, I want to first thank the author and the sponsors for making the clarifications needed that's in the bill. Jim Gross is right. We've been working together. We've been working together probably for the past 3 years on this issue to kind of try to come to some conclusion as to how to resolve this issue in law. There is one issue remaining, and it is true it is the crux of the bill. CNA is requesting that the doctor indicate in the diet order that modifications by the dietitian is safe and allowed for that specific patient. We don't understand that in a hospital setting, dietitians are having a hard time tracking down or calling the physician responsible for the patient. In hospitals, doctors and nurses are available 24/7. Everything is run through a physician order and carried out by the nurse at the bedside. We appreciate that the collaboration between doctors, RNs, and dietitians is in the bill, so that should not be an issue within that collaboration process that the sign-off on a diet order can happen. We believe, and the way we read the bill, that it is independent authority for dietitians to modify therapeutic diets for patients whose conditions may change very rapidly in healthcare facilities. For instance, a patient may be headed for surgery and is not supposed to have food or drink for 8 hours prior. This is a very critical situation, and it's not just a situation that we're trying to, decide whether that patient should have chicken or beef. With that being said, again, we do believe that 993 is independent authority, and even some of their colleagues have stated in their letter to the committee that they recognize that the bill is designed to implement independent authority for medical nutrition therapy services within licensed care facilities. So, Chair and members, not sure if this bill is intended to resolve issues in some other setting in hospitals, but we can sit down and talk about that. We're happy to have those conversations and move that forward. But we're simply asking for physician flexibility before a diet order can be changed. And we think that that would resolve the issues that DPH has been citing hospitals with. I believe it was a fitting for dentures issue that could be written in an order. We think this is progress, and it's an adequate balance to protect patients. We were listening to SEIU's comments, and although we appreciate those comments, if there were an influx of questions and concerns to dietitians, although we do respect the work that dietitians do, they aren't around on a 24/7 ability, and if there were calls or inquiries to that effect, they're just not around to filter all of those questions and concerns on that basis. With me, I have Vicki Bermudez, who's a registered nurse for 40 years in the neonatal intensive care unit, and she's here to answer any questions you may have. Thank you.
Any other witnesses in opposition? Do we have questions from committee members? Would you like to close?
I ask for your aye vote. Thank you very much, Mr. Chair.